Human papillomaviruses infect the skin and mucous membranes of the human body. While most infections are harmless and clear up on their own, high-risk types of HPV are increasingly causing cancerous growths in the mucosae. This includes pharyngeal tumors, cervical cancer, penile and anal cancers in particular, as well as vulvar and vaginal cancer. Today, HPV is already responsible for 5% of all cancers worldwide, a figure that is experiencing steady growth. Detecting these tumors is particularly difficult because the routine visual examination of several thousand square centimeters of mucosa of each individual patient is virtually impossible. At the same time, established diagnostic methods such as smear tests and biopsies presuppose the presence of a previously identified lesion. As with most cancers, the tumor size at the time of diagnosis is the decisive factor for the prognosis of the patient. Early detection permits the use of less aggressive treatment and consistently leads to better treatment outcomes, along with a less psychological distress and a better quality of life for the affected patient. In close collaboration with scientists, clinicians, and physicians, we have developed the PrevoCheck Rapid Test. The simple PrevoCheck Rapid Test allows early detection then and there in the doctor's surgery. The detection of a highly specific tumor marker makes it possible to identify HPV-induced diseases in the very early stages. It involves an antibody being targeted at a protein structure produced by the tumor. These antibodies circulate freely in the blood. A single drop therefore reveals the existence of a precancerous condition or of a hitherto undetected tumor, and does so within minutes, while the patient is in the doctor's surgery. The test method achieves a specificity of over 99%. In other words, positive results are rare, but always constitute a finding in need of clarification. It can also be integrated into existing cancer prevention examinations, such as skin cancer screening, laryngeal cancer screening, or cervical cancer screening, or the targeted examination of high-risk patients, such as men and women with condylomas in the anogenital area. To perform the test, a tiny blood sample is obtained, either from the earlobe or from the tip of the finger. Venous full blood can, of course, also be used if it's already readily available. The drop of blood is mixed with the previously prepared reagents and subsequently applied to the test cassette. Results are available within a few minutes. Depending on the nature of the result, either 1 or 2 lines will appear. Abviris, the specialists for blood-based HPV diagnostics.